Week 13. Can you believe it? It's been 13 weeks since I had all-on-5 dental implant surgery. Thanks for coming back to my channel. My name is Jane. This is my 13-week post-op update. Had surgery October 19th, 2021. Today is January 18th, 2022. My surgery was done by Dr. Christian Yaste in Ballantyne, North Carolina. That is a suburb of Charlotte, North Carolina. On that day, I had 24 extractions, a great deal of bone grafting done. I did have a large hole in my sinus area that had to be fixed, and I had 10 implants placed, 5 on the upper, 5 on the lower. That day I came home with my lower arch in, the temporary in for the lower. Unfortunately, on that day, they were unable to place my upper arch, so I did come home with a denture. That denture is only to be temporary. My implants just needed a little bit more time to heal, and that is in order to make sure that I have a great result in the end. So I did understand that, a little bit disappointed, but that's okay. I understand the purpose for it. As you can tell, in the last 13 weeks, I have gotten much better at speaking with the denture. I mean, if you go back and look at the old videos, you'll see what a difference it really is. But in 2 days' time, January 20th, 2022, I am going back to the surgeon. He has given me a 3-hour appointment for that day, and we are hoping to put the upper arch in on that day. I am putting it out there to the universe that that is going to happen on that day. So 2 more days, 7 a.m. on Thursday, January 20th. That could be as simple as poking 5 holes, placing the screws, putting the prosthesis on, and I go home unscathed. It could also be as extensive as opening up a great portion of my upper gum line and then placing the screws and the prosthesis, and then coming home, of course, with lots of stitches. So we want to avoid that as much as possible because I don't want to have that recovery time. I do have a great deal of anxiety over this appointment. As I spoke about in my last video, I'm worried and I don't know why. So I just can't wait for this to be over. Oh, sorry, my camera just shut off here. Well, anyway, I can't see you, so I want to make sure I can see you. Hold on. Wow, this should be edited out, but guess what? It's not going to be. So sorry about that. Okay, sorry. As I continue, I guess it shuts off and I can't see it after 3 minutes time. At any rate, I want this to be over. I want to move on to the next stage, and I can't wait for that. So, one thing I decided to do today is to go ahead and take my denture out on camera. Now, a lot of people don't want to do that. There's a great deal of fear that surrounds it for many, many people. And I have been driven by fear with dental issues for many years, and I don't want to be any longer. So I'm not going to have the embarrassment of the denture. It is what it is. This is what I signed up for. I knew that this could happen. I'm hoping that in the end, I get my implants placed, everything's fine, and I go on for the rest of my life with that. But until then, I had to have the denture. So the one thing it does do is it ages you a great deal when you take your teeth out. I don't need any help with that. I'm 51 years old, and I am old enough, and I look old enough, and I don't want to look any older than I look, but there it is. When you take your denture out, it ages you 10, 20, 30 years. So here we go. Without further ado, I'll go ahead and do that. There we go. I didn't die. Here I am. This is what it looks like. Again, as I said, it ages you quite a bit. My speech is now not so good again. You know, it looks terrible, but it is what it is. You can see the lower, and I don't really, I guess, come as close as I can to show you. It could be worse, right? It could be worse. It could be that I have a denture on the bottom too. Or it could be that I simply don't have teeth and I don't have dentures and I wasn't able to afford it. So things could be much worse. I will go ahead and place these back in. Sorry. A little bit of slobber there. That goes along with it. So it's kind of like the woman who everyone says is catfish on TikTok, who takes her teeth in and out and does makeup and stuff. I follow her channel on YouTube. You should as well. I don't have it handy, but you could just Google it. Or, I'm sorry, just put a search in for it and it'll come up. She is actually right now in the process of getting implants. So she's not going to be able to do that anymore, but it makes you look so much different when you don't have them in, especially if you don't have like makeup on or your hair done. Now my hair's not necessarily done, it's just pulled back, and but I do have makeup on, so it makes a little bit of a difference. But there we are. So forever and ever it's been put out there, me with no teeth. So that's it, guys. Think good thoughts for me. I will see you on the other side of getting my upper prosthesis placed. Can't wait to come back and report on that and show you how great it looks. If you have any questions, please leave them below. Any comments, I appreciate those as well. If you'd like to subscribe to my channel, please do. All right, guys, I will see you on the next one. Bye.